Everybody, I'm Lenix. Today, now I'm gonna show you, teach you something general about what is hand, forearm, a little bit an arm as well. So we are gonna cover a little bit about bones, muscles, little bit of anatomy of the elbow and of the shoulder, just in very general, because usually when we study any related with a medical profession, just for example for hand, we are gonna spend one semester, so 6 months, just studying everything hand. So you can imagine when I say that, that is very things that we have in the hands, very complicated but not impossible. So you need one semester. So now maybe in 45 minutes, 1 hour, I'm gonna try to summarize, the general way that you have a little bit idea that you can share with your clients when you are working with them. Okay, so we are gonna start with hand. So you can see here very well. Yeah. Okay. So here on the hand, we are gonna be the bones. So we can find here the bones of the dorsal area, bones dorsal. So dorsal area, remember the anatomy position. I told you that dorsal area is this area. This is the dorsal area. So you know now. So we are gonna see in this dorsal area, we are gonna see these bones that I can fit here. You can hear, for example, first of all, the bone that is coming attachment from here and is communicate with the thumb is called radius. So this bone that you see here, that now when I explain the forearm, we are gonna see very well. This is the radius, and the small and tiny bone that is here, that is they communicate with the finger number 5, the mini one, is called ulnar. So we can find this one. This is the bones that, all together with this bone is gonna form the wrist in the person. Okay. So now here in this, we can see the same bones with both sides, dorsal or the other side. But here in this side, we are gonna see this small bone that here is called triquetrum, that is between the small bone that is between the ulnar, is here, and the finger number 5, this small one. So now we are gonna see here much better the bones. So now in the other side of the hand, we are gonna see again, this is the radius that is here with the thumb, and the ulnar is that is here, with the finger number 5. So in this, with this way, we are gonna see this other bones. We can see here, talking the radius and talking the thumb, we are gonna see between there one bone that is called scaphoid. Is here, this bone that here is scaphoid. Following this one, because when we study the hand and we see the bones, usually it's more easy learned in this way, the palmar area of the hand. It's good. And we are gonna talk about 1-2 lines of the bones, here, 1 to 5 of the bones. So the first one is scaphoid, then a little bit on the middle, you see that is between the finger number 3 and 4, we can find the lunate that is here. Yeah, and the last bone going to the middle side. If you study anatomical position, we are gonna find the pisiform. Pisiform is following the finger number 5. Okay, so this is the first, line of bones. Then we are gonna be a little bit more distal. Remember, distal is going far from the body, proximal is going close. So a little bit more distal, we are gonna find another bones. Here, if we start, from the lateral side of the thumb, we are gonna find here the trapezoid. Trapezoid here is. If we continue going more medial, we are gonna find the capitate, that is this one. And the last one is one small bone that is on the top here. Let me this. Bones dorsal. Remember I talk about here these bones that are here in this area. So when you go to the palmar area, on the top here is a small bone is called hamate. So this is the bones that you can find. So this is as same like when we're talking, for example, of the feet, we're talking about the tarsals. When we are talking about the hand, we are talking about the carpal. So this is the carpal area. So carpal area are these small bones that I show you now. Now we are gonna follow with the talking about the metacarpal area. Saying like the, for example, feet bones is the longer bones that are here. So this is the metacarpal area. So saying as well, so we have here the names of the metacarpal is number 1, number 2, number 3, number 4, number 5. It's the same like that, metacarpal. And then we are gonna continue with the phalanges that are here in this area. Same like when talking about the feet, the thumb have metacarpal, and then when we're talking about the phalangeal, we're talking about the distal and the proximal. Doesn't have the medial phalangeal. The other fingers have it, you know, you see proximal, medial, and distal. But this one, same like the feet, just have 2 phalanges. So this is the bones of the hands. It's no difficult to learn about that. Okay, so now we are gonna see something general about the muscles. So when we're talking about the dorsal area, we are gonna talk about the extensor muscles. And if we're talking about the palmar area, we're talking about the flexor muscles. So in this area, that is, you know, the superficie is superficial and deep, as same as the feet, as a lot of muscle that we have to divide in different layers to can find muscle. So general, we can find here, and we can see here that the thumb have his own muscles as well. See, when you we are saying about this one, the digiti mini, saying like a feet, these two has his own muscles. So you can find here the abductor, because it's the muscle that is in charge of spread the fingers, and the flexor digiti, so it's in charge of the flexion. Why is brevis? Because it's coming until here. If we're talking about longus, it's because it's coming until here. It's the more easy way to learn. And here we can see the abductor, talking about the thumb. So abductor, remember, is spread as well. So abductor for this one, abductor for this one. And flexors as well for this one. Brevis, why? Because it's coming until here, not to here. So this is this layer of the bones. Tenar and hypotenar, why? Because this area of the hands is called tenar as well, and this part of the hands is called hypotenar. So, okay. So we are gonna see here another kind of muscle. We are gonna see that here I'm showing just the muscles of the thumb and on the finger number 5. You know, so we can hear. Why the number of these opponents policies? Because this thumb is called policies, and this one are the mini opponents. Why opponents? Opponents is this kind of movement that you can do here, like that. This is the opponents. So if you see, these both as openings. But if I do this one, you can say, but you are going to do openings as well here. But no, but when I do here, you see that I'm doing is just the flexion of the finger. But when I go to put together this one, you can see that this one go to the middle, and this one is go to the middle and flexion as well. So this is why both of these fingers have opponents muscles, opponent that come here. Come and do this movement. This one just do the flexion. So flexion, and this one come together like that. This is why it's opponents. Okay. Here, this is extensors as well. Our muscle that you see is in the dorsal area and is between the metacarpal. No, this is the dorsal interosseous. Now we're gonna see the abductors that I told you. Abductor is comes together, so we can see that is about the pollicis. That is the name of this thumb. You can see here. Palmar, remember all the muscle that is in the palmar in charge of the flexion, of the dorsal in charge of the extension. Okay, we see this. Okay, here is the side of the hand. You can see that again this pollicis, that is the name of the thumb, have its own muscles. So here we can find the extensor pollicis longus. Longus, why? I told you, because go, to the last phalangeal. We can see here the abductor pollicis. So is the muscle that is in charge of a spread or abduct the pollicis of the thumb. And the extensor pollicis brevis. You see why I say longus? Longus, look, is go to the last phalange, and brevis is go to the middle phalange here. Sorry, distal, because the thumb just have two phalanges. Okay, this is important as well. You need to know the names in Latin, because you are going to understand what is longus, what is brevis. Longus, longer. Brevis, short. So you have to know that. If you recognize, very well the names in Latin, medical terminology, when you put together, you are going to understand what you're talking about. Okay. Here we're talking the same. This is about the tendons. Okay, this is one talking. You see why I say that anatomy of the hand is sometimes studied in one semester. If you see here, here is just one finger, one metacarpal bone and the phalangeal. And in just one finger, many things you can see and many things you can study. Okay. Here you see in each phalangeal is coming one of the extensors tendon. Because you can extend the distal phalangeal as well the metatarsal areas in your hand. So for each one, you have to have each muscle in charge of that. Okay. This one, yeah, this one. Okay. I'm talking about the nerves. About the nerve, same, you need to know very well the anatomy and nerve from the vertebral column. So you are going to see that here the innervation. Here, for example, remember this is the radius and this is the ulnar. So all that is coming from this one is called radial and this one is called ulnar. So we have the medial nerve. Here, the important nerve, radial, median, and ulnar. Medial nerve is this nerve that is coming to innervate the thumb, the number 1, the number 2, and the half side of the, you see anatomical, is this is the medial side, you see here, of the number 4. And the other side of the other side of the number 4 and number 5 is innervate for the ulnar nerve. Yeah. So why I'm talking this important, all nerves are important, but very, very common when you work in physiotherapy or massage therapy, you are going to find something that is called carpal syndrome, tunnel syndrome, that is here. So we are going to explain. The medial nerve is coming under this. We have ligament, big ligament that is called transverse carpal ligament. Why carpal? Because it's in the carpal area. Why transverse? Because the direction that is attached. So the medial nerve coming under this and between the carpal bones that are here. So when the person do a lot of repetitive movements of the ribs, this area get very tight, very swollen, and the medial nerve is gonna be squished between the transverse carpal ligament and the bones of the carpal area. So this is why person is gonna feel numbness, tingling, pain in all this area of the fingers. See? So when we assessment the person, we just start touching these areas, and if the person say, no, I don't feel very well, or I feel pain, or I feel numbness, and at night I wake up with numbness in these three, we ask, you feel numbness in this here and in this area of the four? No. So just right away we are thinking that the diagnosis is, problem in the medial nerve. So it's carpal tunnel syndrome. So you can see here. This is why it's important to talk about this nerve. You see? So remember, is the medial nerve, a trap between the transverse carpal ligament, carpal area between the carpal bones. This is the easy way to learn this part. Okay, and we can find same like at the feet. We can find here flexors muscles, extensor muscles, lumbricals, so muscles in charge of, of flexion, for example, because if you see the movement of the hand, we can flex here, we can flex every phalangeal, we can do this movement, we can extend here as well. So all these things, and as well when we are working the wrist, we make extension of the wrist. Sometimes we flexion of the stick of the wrist without flexion of the fingers, but sometimes we can flex the wrist and at the same time flex the fingers. So this is why it's a lot of muscles working here, because depends of the area that you move, the muscle is gonna be active. So for now, the more general way is like that. When you're talking about this one, the thumb, you are talking about the hallucis, you are talking about the minimi, yeah, you are talking about digitorium. If you're talking about the feet, or sometimes here it is the rest of the feet, the rest of the finger. Another thing important here, remember the medial nerve. Remember as well, here is the flexor muscle, here are the extensor muscles. If I'm talking about longus or brevis, longus is because go to this phalangeal, brevis is because it's going to this phalangeal. It depends, longus because I can flex here, I can do this one. Longus, brevis because I can do this movement. So many things. Opponents, remember opponent just in these two because I can do this movement. Remember this thumb has his own muscles as well as this one. So have muscles that do abduction, adduction, and opponents, as well flexion and as well extension. So remember all these general things that you can as well. Remember this is the area of the carpal, here metacarpal, and here all the phalanges. So this is the general way we can see the anatomy of the hand. So now we are gonna proceed with the forearm. So here in forearm, we are gonna find, I told you, two bones. This is the radius that is in connection with the hallucis or the thumb, and the other bone is called the ulnar. So we can find here some muscles. You can see that, for example, the flexor muscles, you see, coming from all the same. For the anterior side, anatomical side, we are going to find the flexor muscles. Dorsal, we are going to find the extensor muscles. So here we are looking, the superficial layer with the dorsal side, so we can find the flexor carpi radialis longus. So you see the name flexor because the function is flexion. Carpi radialis, carpi because it's going to all this area, carpal, could be here metacarpal, and radialis because it's following all the radius bone. Longus because it's going, more than the wrist, more distal than the wrist. So this is the way to learn the muscles more easy. Here we can have the flexor carpi ulnaris because it's here in the carpal flexor, flexion of the wrist, and carpi because the insertion is in the carpal area, ulnaris because it's following the ulna. The palmaris longus is the muscle you can see that just go to the palm area that is here. Longus because you see go more distal. Okay, here we can see one small muscle that is called pronator. When you talk about the wrist, you can talk about these movements that I show you: flexor, flexion, extension. This is radial deviation because this is the radius. Ulnar deviation because this is the ulna. Now talking about the elbow, we are gonna talk about flexion, extension, and another two movements that is going here, that is pronation and supination. So the elbow have to be, flexion 90 degrees and pronation and supination, and not moving the shoulder. If I do this one, it's different. So I'm working just here like that. Yeah. When we're talking together, elbow and wrist, because the muscles, when you're talking about the wrist flexion, the muscles that do this action are coming from here. The attachment is for here, flexion. This is why when we're talking about tendinitis in this area, we are talking about tennis elbow, So it's because it's the flexor muscles of the ribs, not all the shoulders. So don't get confused on that. This is why you have to be clear in anatomy. So tennis elbow is the tendinitis of the flexor muscles of the wrist. And when we're talking about the golfer's elbow, we're talking about the tendinitis of the extensor muscles of the wrist that come in here. So when we study hand, we spend a lot of months studying hands, and we have together come and study again the forearm and again the elbow to can understand the movements. So the Pronator Teres is one small muscle, you see, that is coming. If you can see here, we are gonna talk about another bone that is called humerus, that is in the arm. Forearm is this area, arm is this area. So the Pronator Teres is one small muscle that is coming, you see, for the distal side of the humerus, and is coming attached to the radius. Why? Because it's in charge of this movement. You see? So he's coming from here, and he's gonna do the pronation here. So it's very short muscles that is here, and it's called Pronator Teres. Okay. Here we still talking about the flexors. So the same, you see the medial nerve that I talking when I talk about here the hand, the medial nerve coming, all the nerves that come to innervate hand, forearm, and arm are coming from the cervical and thoracic area, always. So when we talk in foot, we talk about lumbar and sacral side. Here we are talking about cervical and thoracic area. You see here the flexors. Flexor digitorium superficial muscle. So flexor because it's gonna help to flexion digitorium of the digit of fingers, and superficial because it's not too deep, it's more in the superficial area, so it's a little bit more way to learn easy. Coming from here, all the palmar anterior side and palmar side, and coming like that. So this is the flexor. Okay, here we are gonna see the extensors. So long extensor, remember I told you extensor is in the dorsal side of the forearm and of the hand. So we can find here all the, for example, extensor carpi radialis longus. So extensor, extension. Carpi because it's gonna here to the carpal area to attach. Radialis because it's going to the way to the radius that is here connected to the thumb or hallucis. And brevis, why? Brevis because it's coming maybe attached here close to the metacarpal or carpal area. It's not going to the phalanges. So this is why brevis. Extensor digitorium communis, when this is extensor that is for all the fingers, this is why it's communis. Extensor digi minimi, why? Because it's the extensor of just this finger number 5. So this is why it's minimi. Extensor carpi ulnaris, same extension. Carpi because it's coming to the carpal area. Ulnaris because it's following the ulna. Ulna is the bone that is connected with the finger number 5. So this is a little general that you can understand. Okay. Okay, I talk about pronator muscle, pronator teres. So, but I talk about supination as well. So, who is in charge of the supination? Supinator muscle. So, the supinator muscle, if you see where it's attached here, is the opposite side of the wrist pronator because it's the another action. So here is the supinator, is a small muscle as well that is coming from the humerus here to the bones of the forearm. And here we are gonna see as well, remember I told you this thumb is called pollicis in medical terminology. Extensors pollicis longus. Extensor, we are gonna think in the dorsal area, is gonna make extension. Pollicis because it's coming to the for the thumb, and longus because it's coming to attach maybe to the median or last phalange. So extensor indicis profundus. So extensor dorsal area extension, indices anatomic medical terminology. The first finger is called indice. So this is why extensor indices properius or profundo. Okay, it's gonna a little bit more deep. And abductor pollicis longus. So abductor, remember what is spread. So the muscle, the thumb that have abductor is this one, pollicis longus, because it's go to the last or median phalange. So this is the general way that we can see, you know, this kind of muscles. Okay, very good. So now we are gonna talk a little bit about elbow. So here we are gonna see elbow. We are gonna see the anterior side of the elbow. So the anterior side of the elbow, we are gonna find the elbow joint is the union of everything come together about the humerus, radius, and ulna. Okay, so we can find the humerus is here. We can have here the ulna. Remember, the ulna is the bone that is going to make connection with the finger number 5, or anatomical position. The ulna is close to the medial side of the body, and radius is in the lateral side of the body. Okay, so I thought as well that when you learn about bones, it's not just learn the name and the location of the bone. Each bone has its own parts, and it's very important, you know, that you, for example, know that this part of the humerus is called coronoid fossa, or that the little, you know, like a protuberance of the humerus, lateral humerus, is called lateral epicondyle or medial epicondyle. Why is important recognize and learn all these parts? Because when you have to learn about muscles, origin and insertion, you have to know very well where is the insertion of the origin. So many muscles is coming to, for example, origin or insert in the medial epicondyle of the humerus. So you have to know very well where is the part of the bone. So you can see ulna, for example, tuberosity. So every bone has its own part. So it's really important that you learn. Okay, this is the posterior side.
Okay, so in the posterior side, we can find here as well. It's very important, you learn. The posterior side is like we are gonna call, we usually in any no medical terminology, we can say this is the elbow, you know, when you touch this part of the back of the bone. But the elbow is everything together. This small part is just called olecranon process. That's it. This small part that is here. Okay, is what we have, and then about ligaments, everything. Synovium, what is the synovium? So between each joint, we are gonna find like a bags or bursas or cartilage that is gonna help to you know that you can make flexion or extension of the joint or any kind of movement on the joint. And if we don't have this thing here, both bones, this bones and this bone is gonna meet together, and you can't move, or if you move, you are gonna cause the degeneration very fast of the bone, and it's gonna be painful. We can see this, for example, in arthritis. We can see this problem when all the soft tissue that is around here and inside here is gone, you know. So the bones come together, so person can move, for example, the elbow, knee, whatever, and it's very, very, very painful because both bones are gonna come together, you know, so it's very, very painful. Okay, this is the lateral side of the elbow. So we can see the olecranon that I mentioned last time. So the olecranon, so that I show here, is the proximal part of the ulna. So this bone that we touch here when we are anatomically here, when we do dorsal, this bone that people will refer of the elbow, say this is the elbow. The elbow is everything here. This part that we can touch here is the olecranon, and the olecranon is proximal part of the ulna. We can see here. And the radius is bigger, the radius is here. Okay, so in this side we can see the elbow is like that, in this position. So here